think that the first solution for skin aging is photoprotection. That's by far the most important thing. I practice in a very sunny climate, and I can tell where my patients were raised just based on whether they were raised in South Florida or in the northern United States, because sun and UV radiation plays, to me, such a tremendous role in photoaging. So the key is photoprotection. So in my practice, to manage photoaging, we have three main things that we pretty much all do, which sun protection, as I mentioned, is key. And I always say it's never too late. I always tell my patients about someone I used to take care of who was a golfer, was always in the sun, and was in his 70s. And was coming in regularly for treatment of precancers and some skin cancers. And one time he came in for his routine visit and his skin looked much better. And I said, "What did you do?" He said, "I started wearing sunscreen." So it's never too late. We sometimes think of it as prevention, but even in the 70s, I saw an improvement in his skin in someone who was golfing every single day outside. Just adding sunscreen reduced all of that kind of actinic damage in the short term. So I've observed that in South Florida. So sunscreen is the most important thing. Antioxidants, usually I add an antioxidant in the morning, and it doesn't have to be any one in particular, although I think vitamin C is very popular right now, but green tea, but really any antioxidant in the morning. And the reason why I add an antioxidant is because we know that if you're using a SPF, you're blocking the UVB, maybe 97%, but the 3% that does get into the skin, I think the antioxidant helps to manage the free radicals from that. So when you add an antioxidant to an SPF, you get better photoprotection than just the SPF alone. And then of course retinoids at night. So those are, I would say, the basics of managing photoaging in my patients. I also tend to have a lot of patients who are skin of color, so they also tend to complain more about hyperpigmentation. So usually at night, I add in an ingredient to address the hyperpigmentation. In the short term, I'll use hydroquinone. In the long term, I will use a hydroquinone-free alternative. So I use hydroquinone as a quick fix, maybe 4 to 6 weeks, and then try to maintain with a hydroquinone-free alternative. So that's a great question, and I do recommend oral antioxidants. The one that I use the most is actually Polypodium leucotomus, and that is an extract from a tropical fern that has lots of scientific data to show that it protects against UV damage. So in the sunny climate that I practice in, if someone has a big problem with the sun, so either they're very sensitive to the sun, a little photosensitivity, or they have hyperpigmentation, melasma, I will add an oral antioxidant, and they can take it once a day for regular sun exposure. But if they're going to spend the day at the beach or the day at the park, they can actually take 2 doses to help manage that. And there's great studies to show that Polypodium leucotomus reduces UV dimers, UV-induced pyrimidine dimers, and the sun damage that we see. I think it also shows a reduction in sunburn cells. So it's a very good thing to take preventatively if you know you're going to be spending a lot of time in the sun.